I think one of the perfect segues from John Robinson was his slide where you got to have a plan. And I think that's what's going to come through loud and clear in my presentation this morning, is without a plan, all paths lead to disaster. I don't want to get into me because Danny's going to throw me off the stage with a hook if I don't get through my presentation in 35 minutes. Well, suffice to say, I did 27 years in the Army and was responsible for some pretty massively large logistics operations, the withdrawal of all Canadian forces from Europe in 92 to 94, closing our base and bringing 18,000 Canadians home with all our equipment, closing out 942 buildings. I followed that up with a tour in the middle of the 95 war in Bosnia / former Republic of Yugoslavia. And I got a phone call from the PMO 1 week into my tour saying, get every Canadian out of the former Republic and get them out now. We sat down, we built a plan, we executed the plan, and 3 months later, we had both battle groups plus the headquarters plus every Canadian UNMO out of the theater. And I got a phone call at 1:30 in the morning saying, stop, drop, we're going to join NATO, bring everything back in. And so we reversed and I did it all over again. The concept is you have to have process. The process allows you to write a plan. You then execute a plan. So let's start, please. Pandemics happen continuously. In my lifetime, since 1954, we've had 5. This is number 5. It won't be our last. I certainly hope it's not my last, not because I want another pandemic, but because I want to keep living. What we have in our country is a system called emergency management. Next slide, next, press once. The emergency management process is in every province and territory in Canada. You pay for it as taxpayers. It's staffed with real people and they have real process. And we use that for fires, floods, tornadoes, and we should have used it for the pandemic. We had always planned to use it for the pandemic. Press once. And I need to hammer the point that a pandemic is not a public health emergency. It never was before, and it never will be again in the future. It is a public emergency, and you use public emergency powers, but you only use them when and if necessary. So let me expand on that point for a minute. This is what Daniel Smith, she'll be here tomorrow, always calls my tube chart. And I used to call it the same thing when I briefed dignitaries on both sides of our border. Every one of those tubes is a sector of our economy, and some of them are made up of public sector, some of them made up of private sector in varying amounts. So for instance, if you look at the energy sector, one of the pieces of that tube is our power grid. Predominantly private sector, but with regulatory functions that are public sector. And every one of those tubes, the healthcare sector, the agriculture sector, all of them, we work just fine, all on their own, until a major emergency or disaster hits. Press once. In every province and territory in Canada, that's when our first responders step in. When it gets past their ability, our municipal order of government. Here in Alberta, we train specifically an emergency management organization in every one of our 314 municipalities in Alberta. They step in immediately, they have plans, one of which was the pandemic plan, and they execute them. But when it goes past the ability of a single municipality to respond, press once, we then have provincial agencies. Here in Alberta, it's the Alberta Emergency Management Agency, but every province and territory in Canada has an EMO. They're trained, and what they're trained to do is to bring process to chaos. All right? They're the people that bring all the experts together across every one of those tubes and build a cohesive plan with everyone in the room. Then each of those tubes go back to execute their portion of the plan. Press again. When it exceeds the capability of provinces on their own, there's an EMO, it's called Public Safety Canada, for the federal order of government, who helps all the provinces link together. And one of the critical concepts in emergency management is mutual aid. It's not a bad thing when one province helps another province, but you'd think it was during this pandemic. Press again. So one of the biggest pieces that links into all of that is the private sector. And when I ran counterterrorism starting on September the 12th for Premier Klein, we learned that 85% of critical infrastructure is in the private sector, not the public sector. So you need all of their expertise in that planning room right from the start. I think you've seen demonstrated by what we've done, they've never been in the room. So we have this process and we had pre-written plans. And those pre-written plans, there's 13, one for every province and territory in Canada, and there's a website at the end, you can go look them up yourself. They were written with the best practices and with all the hard lessons learned from previous pandemics. So, press once. One of the points I really want to emphasize is those plans included the use of what are called non-pharmaceutical interventions. On the left-hand side of this slide, you see the actual document. That was the one produced in September 2019 that covered all 15 of the non-pharmaceutical interventions. And there's a link at the bottom. You can Google it for yourself. It's 60 pages long. And it goes through each of the 15 in detail and it says what they're good for and what they're not good for, and what the concerns are if you use them. There's the 15 of them listed on the right-hand side, and shown in green are the 3 that were applicable to this pandemic that we should have used right from the start and all the way through. Those wonderful things like wash your hands. The next ones shown in orange are things that were partially useful in this pandemic, and we can talk about any of them in the question period that you want. But the ones shown in red were strongly recommended not to use for this pandemic. Contact tracing, quarantine of exposed individuals. We keep sending healthy people home in ever increasing numbers when the only one that you should have done is isolation of sick individuals up there in the green. So the reason why we send an entire wing of a hospital home because someone walked into that ward that was infected makes no sense. But it's worse than just they don't make sense. We knew that those non-pharmaceutical interventions, which you now call lockdowns, they were never called lockdowns before, they were non-pharmaceutical interventions. We knew they came with massive, severe collateral damage. Next slide, please. In the Alberta plan and in all the plans, there were 4 goals. I'll let you read them yourself. But goal number 1 is the one that our medical officers of health have put all their time to while completely ignoring the other 3. And they've completely failed at number 1. And I'll explain that in a minute. But have we mitigated social disruption in our country? We've done exactly the opposite. Have we minimized the economic impact? We have doubled our national debt from $750 billion to $1.3 billion in less than 15 months. Next slide, please. The purpose of a written plan is, first of all, the process to bring everyone together and make them part of the plan so they know their part in the plan and where they fit and why. But more importantly, you then issue it to the public. You use the media, and every Albertan, every Ontarian, every person in Canada should have a copy of their province's pandemic plan. They then know their role in it. But as well, it describes if extraordinary powers are ever going to be used and explain exactly why those powers might be used. That's the minimum to do due diligence to justify any breach of charter rights and freedoms. When I was placed in charge of counterterrorism on September the 12th in the province of Alberta, 2001, my aim was to never deny a charter right or freedom. I'm an old soldier. I've been some places where I've seen complete breakdown in civil order. I understand what happens when freedom is lost. I've seen it personally. My aim in counterterrorism was to make sure the terrorists never won, that we never denied charter rights and freedoms, because then they would have won. We've handed those powers to our medical officers of health and have completely denied charter rights and freedoms for no reason. Next slide, please. Our response, province after province, has been a game of one-upmanship, completely incoherent, and each province trying to outdo each other in terms of the severity and duration of lockdowns. It's ridiculous. And worse than that, it is killing people in great numbers. I've written a paper. You'll all get copies of the slides. That's the paper I wrote after I gave up trying to help premiers after 12 months. And it is my paper on how we should hold premiers and medical officers of health criminally accountable for what they've done. The focus on COVID-19, instead of the aim or the mission statement, the correct mission statement for a pandemic is to ensure COVID-19 had minimal impact on the people of Alberta, Ontario. Minimal impact. Instead, the mission statement immediately became to protect our medical healthcare system. Two completely different missions, and everything wrong falls from the mistaken mission. If all you're trying to do is protect your medical system, you're not protecting any citizen. Next slide, please. What did we know in February and March of 2020? I want to take you back 19, 20 months. This data was available to every single one of you because this is how I got it every single night in February and March. Type in, when you're free, Sweden, COVID deaths by age. Norway, COVID deaths by age. United States, COVID deaths by age. France, COVID deaths by age. And you'll find out the same information I found out. And so I knew right away that it was killing people over the age of 60 with multiple severe comorbidities. Next slide. The WHO data by the second week of March was definitive. 95% of the deaths were in people over the age of 65 with severe comorbidities, normally 2 to 4, not 1, 2 to 4. Average age of death in Canada, 84 years old, 2.8 comorbidities as of yesterday. We knew that in February and March of 2020. Next slide, please. So we should have immediately done targeted protection. We should have protected our seniors who were most at risk, while everyone else simply wasn't at risk. It's been confirmed, we know it's true, but even then we knew it was true. And this is the data from last Saturday out of Canada. You can get it off the Canadian website, I put it right there for you. 680 people have died of COVID under the age of 60 in our country. Total, in 20 months. We lose more people as traffic fatalities. In fact, we lose double that number as traffic fatalities every year. Next slide, please. Here's Alberta, 91%. Alberta has a younger population than the average in Canada. Average age of death in Canada, 84, 2.8 comorbidities. You can see how many young people have died. It's the same as we see from things like pneumonia every year. Next slide, please. But we don't close our economy for pneumonia. This is off to the government of Alberta. Only 3.8% of the people total who've died in the province of Alberta had no comorbidity, or at least none that was registered at the time of their death. But you can see the vast majority had 3 or more severe comorbidities. Next slide, please. I'll leave you to read this on your own time. Copies of the slides will be available. You can have them digitally, but this is what our government should have been doing to build confidence in people. If you're between the ages of 20 and 40, you are 5 times more likely to die in a car accident driving to work than you ever were from COVID. Heart disease takes double under the age of 60. But look at the facts for our comorbidity at-risk 70-year-old seniors. You're twice as likely to die of a heart attack if you're over the age of 70 than from COVID with comorbidities. Next slide, please. So 20,000 out of our deaths in Canada, as of Saturday, have happened in long-term care homes. We did no targeted protection for our long-term care homes. We abandoned our seniors. And you heard John talking about the OECD, the Organization of Economically Developed Countries. We came last in the OECD in protection of our seniors. Next slide, please. Unconscionable. I believe we could have, in the first wave, quarantined every long-term care home in Canada. There's only 2,035 of them. We could have spent $2 billion, increased staffing, and I can discuss in question period how I would have done it, but I mean staff and patients. By the end of the first wave, we would have been able to develop rapid testing, so we wouldn't have had to do it the same in the second wave. We chose not to put any emphasis on rapid testing, and we chose not to protect our seniors at all, so it was never an issue. We just let them die. Next slide, please. We've spent $500 billion locking perfectly healthy people at their homes when we never should have closed business or our schools. We could have protected our seniors, and we should never have sent healthy staff home from hospitals. It's strongly recommended against because it doesn't work. Next slide, please. We should never have followed what China did. That's what an authoritarian dictatorship does, and it doesn't work, and it causes massive damage that I'll talk about in a minute. And we had 2 months notice, all of January, all of February, and most of March. So what did we do? We did nothing. The emergency management staff should have been activated by the second week of February, built the governance team under the direction of the Premier, and put in place a written plan by the middle of March. Next slide, please. So let's talk about what's hidden. Next slide. This is one study that shows definitively comparing lockdown countries to non-lockdown countries in the same geographical temperate zones and comparing populations with rural versus urban populations in equal measure. You can read the findings. Dr. Jay Bhattacharya, Ioannidis, these 4 people are 4 of the best infectious disease doctors in the world. One of them is one of the authors of the Great Barrington Declaration. The conclusion, comparing lockdown to non-lockdown countries, says there's no significant benefit on case growth. That means lockdowns do not stop spread, folks. So if it doesn't stop spread, why do you do them? You simply shouldn't. Next slide, please. Sorry. If you don't want one study, there's 35 more by the best infectious disease doctors in the world, totally ignored by the MOHs in Canada, after the first wave, after the second wave, and after the third wave. Those studies cover all 3 waves. Next slide, please. Okay, this is what happens in Canada every single year. This is the annual viral infection curve. Press once, please. That's when WHO declared the pandemic. So we had this pandemic, and we're in a very high seasonal influenza period. So COVID spread naturally, just like it does, whether it was COVID or non-COVID. Next, press. This is where we declared our lockdowns, and everybody went crazy, and it came as a complete surprise to everyone, including the hospitals. Press again. And this is when our MOHs across Canada declared that lockdowns had worked. They had saved us all, because look at the rapid drop in case count. Remember when you never use case count to manage pandemic? Never. It's a ridiculous measure. But what they were taking credit for, we normally call spring. Right? Happens every year. Press again. This is when we opened schools last year, not this year, 2020. And then suddenly, press again, our MOH has said the case count was going up exponentially. Why? It's called fall, folks. Nothing to do. We locked down harder, we locked down even harder, and the damn numbers kept going up. Press again. Until
Miraculously, in the second week of January, they leveled off and started to drop, just like they do every single year. Had nothing to do with lockdowns. Lockdowns didn't stop for 2.5 months the growth, and then all of a sudden they stopped, and suddenly, magically, lockdowns then worked. Next slide. This is what happened when we hit our third wave. We're still at that high area. Guess what? We did lockdowns, another miracle happened, and lockdown saved us again. We had another thing called spring. I want to point out to you, though, that if you look back at October 15th, 2020, guess what we are, where we are right now? We are the third week of October, and the seasonal viral infection curve is going to go up exponentially, folks. And if they choose to call case counts going up due to the deadly Delta variant, that's what's really happening, not the Delta variant. Press, please. All right, we ignored the other three goals completely, just ignored them. We did nothing. In fact, we locked down businesses to destroy our economy. We locked down schools to destroy our children. Next slide. Way back, September 2019, when WHO published the document, each one of those 15 non-pharmaceutical interventions came with severe warnings. If you use this, you should only use it in a severe pandemic and only as a last measure. We used them as a first measure in March of 2020. We ignored all the advice and all our pre-written plans that existed. And what did we do? We did massive damage to our social, mental, children's education, to other severe illnesses and disease, cancer, diabetes, heart disease, with misdiagnosis and treatment. And we have crushed our economy. Those areas are going to destroy us for a full generation, 40 years, because those mental health issues will only start to emerge as we emerge from the lockdowns, and we're going to be overwhelmed by them. But the one that scares the hell out of me the most is the destruction of our children's education. We know from studies long before COVID that a loss of 1 year of education in a child causes 3 to 5 years less lifespan and a 15% reduction in their life ability to earn money, all of which has massive impacts on their mental health and their ability to live. We've done it for 3 years now, folks. So they are multiplied by 3. We've taken up to 15 years off our children's lives, and we have crushed their mental health. I know this for a fact because I have witnessed within elementary schools, junior highs, and senior highs in Alberta, the complete loss of control of those children in terms of personal disorders and in terms of their lack of learning. Next slide, please. I give you 4 conclusions. Number 1, lockdowns didn't save our seniors. In fact, they probably killed over 15,000 of our seniors because we did not do targeted protection. We did not quarantine long-term care homes, and we never offered, through family practice doctors, any way for our seniors who are living in the community to get to safe harbor. We did nothing to save them. We abandoned them. And in fact, our Chief Medical Officer of Health of Canada has publicly admitted that it's our greatest failure. Too late, they're dead. And the OECD ranked us last. Number 2, lockdowns don't stop spread. I gave you 35 studies, there's way more now. They simply show that the use of lockdowns does not stop the propagation of COVID-19. It doesn't work. So if it doesn't work, what does it do? It causes massive collateral damage, and the most generous cost-benefit analysis, which is what you always do before you take an action, ensure no harm, you have to do a cost-benefit analysis. If you're going to take this action, does it do less harm than that action? We know the minimum is 10 times more deaths will result from lockdowns than COVID ever could have done. A minimum of 10. Dr. Douglas Allen's study out of Simon Fraser University says it's somewhere between 10 times and 200 times the deaths over the next 40 years caused by lockdowns. Our Prime Minister, our premiers, and an MOH knew all this information in February 2020. I knew it, and I'm a layperson. They knew it. They had access to databases that were way better than mine. And all these emerging studies, all this medical peer-reviewed science has been completely ignored for 19 months. Next slide, please. So how do we get out of this mess? Our seniors are still dying, folks. To this day, if you check the numbers from the government of Alberta, our seniors are still dying. They are 95% of our deaths in Canada today, and will be tomorrow. We need to force our governments to produce two plans now. One, the response plan till we take the word pandemic off of our list of things in the morning. But we also now have to write a recovery plan, and I'll talk more about that in a minute. We need to vigorously enact that plan now to protect our seniors, right now, in our long-term care homes. They're not just saying like it's okay, there's another outbreak in a long-term care home. Unconscionable. And these people are double vaccinated. Number three, we need to ensure all our critical infrastructure, not just hospitals, are ready for people to get sick this coming flu season, just like we've always done, but with a little more emphasis. We need to remove the campaign of fear, and I can't emphasize this one hard enough. This takes a plan, a written plan, with all the experts in the room on how we're going to walk our public back from the belief that lockdowns work, that vaccines are the only way out of this, and that there is no other idea how to deal with a pandemic, because we're going to do this again in the next pandemic if we don't break that. But we can't even start a recovery plan until our public stops screaming to be locked down. It's not the MOHs anymore. It's the mob. The mob is demanding children be removed from school to save their lives. Their lives aren't at risk. All right? They're simply not at risk. Next slide, please. Step 5, end all talks of future lockdowns. Simply state they will never happen again, period, for this pandemic. That's step 1 in the removal of fear. Business can't open. They know we're going to screw them again 3 weeks from now. Number 6, guarantee we will never, ever stop school from being open and in-class learning for our children. We can at least stop destroying our children. We're going to have to fix what we've done to them, but we've got to stop keeping doing it. Number 7, people under 60 without severe pre-existing conditions, go back to work. Remove all the benefits that keep you at home, all the benefits. And number 8, continue to vaccine as vaccines come available for the current strain of COVID-19. Do you know that there's over 3,000 variants? You only ever hear of Delta, but last spring you probably heard of Lambda, and before that you probably heard of Alpha, and before that, there is a complete list of them. They're broken into variants of observation and variants of concern. There's 10 in the bracket of concern. The one thing about vaccines, they take 3 years to develop for a reason, so that they actually do what you think they're going to do in a consistent manner. When you rush a vaccine, you have no idea how it's going to turn out. And the thing that we know for a fact is that Delta has escaped the vaccine envelope. It's escaped it all over the world. It's no surprise. It's coming our way. We're already seeing a significant number of people, like 30% in hospital in Alberta, fully vaccinated. Why? Because Delta's escaped the envelope. Next slide, please. Sorry, the recovery plan. Don't go back. We need to write, with the same full emergency management process, a recovery plan. And step 1 is removal of fear. But there will be 40 or 50 other steps. And that recovery plan has to address mental health and what we've done. Societal health, children's education, how we're going to make that up, and try and decrease the damage we've done, how we're going to overcome the massive economic disaster we've created, and how we're going to deal with the misdiagnosis and treatment of all our other severe diseases, which are now going to overwhelm our hospital system. Next slide, please. This was drawn by a 15-year-old girl in the middle of the second wave. At the back, you see all the body bags stacked up. That's our seniors. They're dead and gone. You see our schools burning to the ground, our children's education. You see mental health, absolute body bags, people dying from mental health issues. And if you don't think that the opioid crisis is actually a mental health crisis, that's what it is, folks. Cancer, diabetes, heart attack, societal health, and the complete destruction of our economy in flames. That's what a 15-year-old girl thinks of our premier hiding behind an MOH who's telling us we have to do this. Next slide, please. I want to leave you with references. You can go to those yourself. There you will find actual peer-reviewed science that backs up everything I've said. My paper's at the top. The second paper I've written with the expert infectious disease doctor here in Alberta, how he still has his job, I have no idea because we publish together frequently. And the bottom is the site that a team worked with me in Ontario to build. It is a complete collection of all the Canadian-focused plans we had and all the research that's happened right up to date. Next slide, please. I want to leave you with two thoughts. If vaccines in the current form work, why is 31% of the new cases fully vaccinated individuals in Alberta? We can discuss that in Q&A. I have my opinions, but I'm not a doctor. Next slide, please. That's an elephant. That's Boris Johnson back in the second wave, trying to decide whether he would do option A or option B, both of which were locked down. There was no other option. And the elephant is holding the little flag of sweet. A little flag of sweet. Push the button, please. Since the start of COVID, this is the deaths in Sweden. Looks exactly like ours. They did not wear masks. They did not close any business. They did not close any schools. And they did not cause a massive economic burden on their society. They decided that they would try 1 meter physical distancing where possible. Press again. 2 more slides. This is their waves, just like ours. The difference is, look at what's happening since July on compared to us. Push the last slide. Here's the deaths in Sweden. Since the start of summer, it's over in Sweden. They've declared the pandemic done. So did Norway and Denmark, who followed their model. So did Finland. Okay, last question. We are 3 minutes till my time is up. I would take 3 minutes worth of question and we'll get Danny back on track, but I come back again later for a Q&A right before lunch.
Doug was asking if these slides were going to be up, and yes, we'll get this up on the website as soon as our volunteers can get to it. But yeah, there's so much information, it's hard to take it in. But yes, we do have time for 1 or 2 questions. Is anybody? You'll have to shout it out. I don't think we've got a roving mic. Go ahead, Bill.
In your opinion, why governments not follow the plan?
Let me just repeat the question so the people at home know what the question is, and then you'll have, I think you have to come back to be on the camera. Will you? Yes, yeah. So the question was, why did the people in charge not follow the plan? Yeah, that's the $100 billion question, isn't it?
So I can only give you my opinion because 13 out of 13 premiers refused to respond to me when I emailed them 12 times in 12 months and gave them the options. My opinion, number one, everybody saw what happened in China and what happened in Italy and then what happened in Spain, and fear gripped our leadership. We were totally failed by our leadership. They were supposed to be in charge and do what they knew they should do. When I ran emergency management Alberta, every time there was an election, there's a binder placed on the premier's desk when the newly elected premier walks into the room, even if they're re-elected. They have to go through the binder again. So in the first week, one of the first people to brief the premier in every province and territory in Canada is the head of the EMO. And basically what it says is, when in emergency, call EMO. There's pre-existing plans, and the EMO will help guide you through the process to establish a governance model, a governance team. We'll coordinate the governance team, and then we'll run all the different subgroups to write a written plan. If you go to my paper, you'll see step by step how that happens. What did they do? First of all, incompetence. I use 3 words. Incompetence. The leadership, the premiers were incompetent. They didn't go to their binder. They didn't know what to do, so they put the MOH in charge. Step 1 of incompetence. Step 2, the MOH accepted the leadership role. Never should have. Incompetence. Wave 2, hubris. Once you have stepped into a flawed response, to admit it will cost you your political career and your medical career. So hubris says double down. And the third word I use is self-gain. The minute people saw the response to COVID, they looked for ways to gain from it. Our media certainly did. Our prime minister certainly did. Started spending $10 billion a day to keep people at home and watch his poll numbers go up. That's self-gain. So why did they do it? Incompetence, hubris, and self-gain. That's why I'm here.
The world did that.
Yeah, sorry.
Not the whole world. There were holdups. Sweden, Dr. Tegnell personally ran the response in Sweden, had life threats against his children, against his wife, against himself, and did what we call leadership. Courage happens when you do the right thing in the face of overwhelming adversity.
What is the relationship between the EMO and public health?
There's obviously 2 groups here vying for control of it, here in the beach. Are they cooperating at all?
They're not cooperating. The EMO, all of the people I know in EMOs across Canada have had their careers threatened if they speak up. They have been told they will be fired if they suggest that what we're doing is wrong. Any word against either lockdowns or the medical officer of health being in charge is met with immediate dismissal. I know some of them that have been dismissed. It is a war that started, and I can show you the email I sent to the premier in April telling him he had a war going on here in Alberta. Ignore it.
You want to come to the mic and then I won't have to, okay, go ahead.
Number one thing you said is end the campaign fear. How do we do that? Because you said the herd mentality, the band is there, and I see no leadership that's going to switch. So
The question is like your number 1 priority was ending the campaign of fear, and the question is, how do we end that campaign of fear? It's a great question.
In my paper, I go into it in great detail. I spent a whole chapter on fear and how to overcome it, but more importantly, how to build confidence in government. Because confidence in government is cornerstone. We knew it back in counterterrorism. I knew it. If I walked in front of my soldiers every morning in the Republic of Yugoslavia when we were being shot at, and said, the enemy's too tough, they're going to overwhelm us, but you know what, we'll crawl back to our fallback positions and maybe we'll live. Or if every morning I walked out the front door of my hooch and my soldiers took one look at me and they said, how are you this morning, sir? And I always say, what's my answer, my love? Outstanding. My word every day is, how are you this morning? I'm outstanding. You saw the soldiers immediately perk up. A premier that steps in front and says, you are more likely to die in a car accident driving to work today rather than COVID. You're not at risk from COVID if you're under the age of 50, but you know what? If you're over the age of 50, we put massive new protections into our long-term care homes. We can offer you, if you're living in the greater community, a safe isolation capability. We can offer you treatments. We can offer you medical advice. We can help you through this. Instead of saying, the case count's going up, our hospital system's going to be overwhelmed, and we're going to have to commit triage in the corridors. Triage has already happened, folks. Lockdowns told everyone with cancer, diabetes, heart disease, and dementia, you don't count. We triage them, they don't even go near the hospital. So we've already committed the triage and killed people.
One last question and then we'll take a break. Go ahead, Ian.
When a terrorist say you have to vaccinate or test, do you comply with terrorism?
The question is, what do you do when people say you have to vaccinate or test?
Terrorists.
All right, let's be very clear. Vaccines for people over the age of 60, in my opinion, have reduced mortality by 4 to 5 times. The bad outcomes from COVID in people over 60 with comorbidities has decreased death by 4 to 5 times. But if you read the short paper that I've published, I think it's on Frontier, but if not, I can share it. On vaccines, my position is you never order anyone to do any breach of constitutional rights and freedoms in an emergency unless the only option is they will die immediately. That's what we use a declaration of a state of emergency for, is when there is imminent and immediate risk to all life. These vaccines were developed very fast and have wonderful outcomes for a very targeted small group of our society. But even for them, I would never order anyone to have a vaccination. It's against the Charter of Rights and Freedoms. It's also against common sense when we know that the vaccines have already been superseded by the Delta variant. And we already know the damage we're doing to our societal framework by the unconscionable breaches of our Charter of Rights and Freedoms.
Yeah, you're right.